are finally opened and we are accepting patients. At Bonahini Specialist Hospital, our extraordinary physicians and nurses are here to provide a high quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in house pharmacy, we have x ray and laboratory services available to you. Come to us for all your healthcare needs, and you will be happy you did because we believe the health is well. Thank you and stay blessed.
yɛatiefoɔ yɛma mo nyinaa adwo ɛnɛ ɛyɛ anigyesɛm kɛseɛ ma yɛn nyinaa bi sɛ yɛnya maame bi ababaawa bi a waben ɛwɔ nnuroyɛ ho a aborɔfo mu yɛfrɛ no pharmacist a ɔba bɛka ɛkwan a yɛfa so a yɛko anaa yɛmanage diabetes ana mogya asikyire yareɛ yɛfrɛ asikyire yareɛ nti no ansa na meyi ne amanaba na afei abɛka ho asɛm akyerɛ yɛn no mepɛ sɛ mekae sɛ yɛ line no mobɛtumi afrɛ yɛn wɔ so sɛ mo wɔ question bi a mpɛ sɛ mobusa a anaasɛ mobɛtumi atext yɛn wɔ yɛ line no so bisɛ sɛdeɛ yɛka no da bia no yɛde we are open for questions na line no number no a mode bɛfrɛ yɛ 240-280-2633 ɛna text line no so yɛ 510-931-0946 neɛ yɛnya ne na a ɛnɛ ɔne yɛn ɛbɛkasa no ɔbɛka no borɔfo no twi ne ayi afrɛfra nti no ɔne Dr. Lizzie Bewia ɔyɛ adwuma ɛwɔ Delaware ɔyɛ pharmacist akyɛ bɛyɛ mfie bɛ edu ne akyire ni aben wɔ pharmacist mu paa yie ɛne nti no ɔne nipa ɔbɛka diabetes management no ho asɛm akyerɛ. So here we have Dr. Lizzie Bewia, who is going to represent diabetes management to all of us. So let us all open our ears and listen to this message. If you have any question, we have two lines here. You can call on 240-280-2633, or you can WhatsApp us in 510-931-0946. Here is she. I present her to continue with his message. Thank you, and you're welcome, Dr. Bewia.
Thank you so much for having me here today. I want to say good, evening to all of our guests from all over. It's a pleasure to be here today, and it's a blessing to have the opportunity to get to share a little bit about diabetes. It affects so many of us. In the US, it's not Ghana kakra. So treating also too much, and so as much as I can, I try to semi country, but to me, I'm kind of Joe. Yo, my God, say. Okay. Okay. And okay. See, Mecca diabetes, just a city diabetes. Essay and Yama or how diabetes causes damage in our bodies. Before says we shall see it, the way diabetes causes damage in your body now, and how diabetes over time that causes complications. So what shall
Can you please increase your volume? I think your voice is very low.
Oh, it is.
Yeah.
Okay, actually my volume is at its highest. So would you mind pausing for a second and I'll get some earphones and I think that will help you hear me.
Okay. Let me pause then.
1 second.
Okay. Tisamre no ya train doctor no fabric to be abantino. Mungina mutie na mesansi bi. You can call us in 240-280-2633 or you can WhatsApp us in 510-391-0946. Today no is diabetes management. This is for the people aged maybe around 40 years plus. Those of you who have diabetes, it's a very good news to you. And I expect you, all of you, to come and listen to this message. Because if you have any question related to diabetes and its management, this is the time to ask those questions. We have a specialist in pharmacy who deals with medication related to the treatment of diabetes. So come and ask all your questions. Those that we can answer them, we'll give you the answers. Those that we can, if there's a need for us to refer you to somebody or one of the doctors who is also expert, who is just tell you to go there. But meanwhile, I want you to listen to us through 240, or you can call us through 240-280-2633. And you can also WhatsApp us in 510-931-0946. Any question that you have, we are more than willing to answer this question for you.
I don't use that one.
This is Era One Radio, the radio that communicates through the whole world. Anywhere that you are, you can get contact with us. Anywhere that you are, if you want to reach us, you can reach us. We answer questions, any type of questions. Now, again, here's a very interesting area that you can also do consultations. We have women's consultations. We have children reading consultations. We have what we call Ghana Munsam. We talk much about it, even though it's not a political related platform, but we deal much about the discussions. And the title of that thing is called Wonsum. Just come to and listen to Wonsum 2. If you come to listen to Wonsum, you always want to come here and listen to what we discuss here. So a platform who hear ye pa. Bomodiana bra Era One Radio. A man of Pong Comobia, sir, Cosiera out with your man come when you bet papa. So and finances, we deal with finances. The Quanya, a fast a HTK ye. Quanya, a fast support top dines, officer could be a dear. A future send you on my and so Dwara Mutad in my eye and Niji pie. Now, you are DBS friend and common kitty. No, dear, a mabba one kwana on be she this uncommon and also radio tabaswa, who say a Niji Semkisia pa, Bana my way, Maba way, woman yin some to hold one, Niji. The baby I will be your wife being said. Era One, only being share. Oh, dear, now what cricket sharing now? The amount done for not sending that rapoma done for. You are done for one sending go movie, not uncle sending go movie, no sending go movie. So the bear, Omun, everything, someone, yet you any, and someone you can want some was outline. So, in fact, so program is health, your health is you know, and also, you can be far up to it will be a custom for Yaria Baya, your friend, COVID, a COVID, who has some quite fast for COVID city, so they are about COVID, who buying now to be COVID, no crying, the day in Chichimu, I see. A pair of fast rabbit one Casana, couldn't be a woman who say when you be not near Ubit Makoye, a bit Mabuana, a swat, and as over transfer in your cry. Where any now bamboo now you come was into the Munya said, Sir, platform me, Unya, Unquan Clown, Wunu Binche, Munche, Namunche, Namushunche. Nasa Moche, Namoche, Namugusu Namocha, Namoboa Aboyari and Hobai. Yeah, Unquan, you can ask him. If the answer Sabri, you can't diabetes, you ask him, and red chum, yɛka prostate ho asɛm, yɛka hypertension ho asɛm, yɛka kidney ho asɛm. Nti nneɛma bebree wɔ no a yɛsua firi yɛ platform yi so. Nti sɛ mpo wonya ntie bi a wode kɔ previous ones nyinaa na kɔhwehwɛ ne nyinaa wobɛhu sɛ nsɛm bebree wɔ mu a yɛaka ebi a na wode bi wɔ mu. Afei koraa yɛsa ka ntontom ho asɛm. Deɛ ne ntontom yɛ ma yɛn? Ntontom ahorow bɛyɛ 300,000 more system no mu kakra na mo ɔde yareɛ ɛbrɛ yɛn no. Kwan bɛɛ so na yɛn yɛbɛtumi aboa na yɛabɔ saa ade no ntontom yareɛ no ba. Ade ne malaria ne nea ɛkeka ka ho. Enti no ne nyinaa yɛaka ho asɛm a yɛapackage no ɛwɔ yɛ history no mu. Nti wode kɔ yɛ history no mu akyiri nyinaa wobɛhu sɛ ne nyinaa wɔ hɔ nom na time na tii na no yɛ ɔnko nkyɛ. Monkyɛ ma mo nuanom. Ebisɛ mo gu so na mo kyɛ no ɛna nkurɔfoɔ bɛnya ahotɔsoɔ ɛwɔ nneɛma a yɛyɛ ne nyinaa mu. Enti sɛ wopɛ sɛ wode w'asɛm bi brɛ yɛn na sɛ wɔkɔhyɛ bi a wakɔhwɛ ne nyinaa bi na apɛ sɛ obisa yɛn a mesrɛ wo a kɔ saa phone number yi 240-280-2633 anaasɛ WhatsApp yɛn wɔ 510-931-0946 0946. Bia Dr. Lisibewia bɛfɛ yɛbɛfa yɛn diabetes no sɛ wɔbɛduru ase nti Dr. ɛkwan da hɔ wotumi ɛkasa.
Vasha, ultimate menka, okay.
Yes, me too nka paa.
Okay, wonderful. Okay, into the na kind of say and I'm sorry for the delay. Na me pay good earphones ana what me at menka. The na me kind of say a good say we better diabetes na say the severe diabetes causal complications and diseases in your bodies. So what you say a Nobel boy no what you say in Rona Wolfano or better say reasons why what's all fun aside no and the way in Rono ye juma I boy your body no to fight diabetes. So basically when you have diabetes, what that means is that woody nyama high in carbohydrates like fufu, like rice, like banche, say cassava, gari, those things, no, high in carbohydrates, pano. Woody those things it goes into your body and turns into sugar. And normally, no, cells it make you the cells in your body use that sugar for energy. Like under normal processes, no, your cells will use sugar now, what do you know? It be used as energy to help you to do the things you need to do for the day. Like cooking, exercising, all the things your body needs to move to do, your cells will take that sugar and use it as energy. However, in order for your cells to use that sugar now with D as energy, no, here BB I say key it be cells no. Sana you sugar now with D no sa pano na with D no and as a mo and as a fufu no. Now I take it sugar no into the cells to use it as energy. So the key no is referred to as insulin. So woody fufu under normal circumstances, it will cause your body to produce insulin. The insulin will cause the cells to open up. Not cells, I take all that sugar that you ate out of your blood into the cells and use it as energy. However, when you type 2 diabetes, one of two things happens. Either your body doesn't produce enough insulin. And so let's say there are 1 million cells anka use and so there aren't enough keys to open them up in order to allow them to take in that that fufu. And so as a result, sugar fufu will turn into sugar, and that sugar will end up sitting in your blood. Another thing that can happen is that your body may produce enough insulin, but your cells don't recognize it. So it would be similar to going home. So wako fie na wa you key so wo baby prona akọ odem. Na efe wo the key no share upno mo a and so I don't know more friend of that insulin resistance, meaning say well body no produce insulin And so for whatever reasons, no, your cells do not recognize the insulin. And so the insulin is not able to open up your cells to allow it to take in that sugar that you ate. So in either way, the sugar ends up sitting in your blood. And as long as you're alive, there, our blood no is running through our veins. Moja is moving all the time through your body. When sugar is sticking to the blood, then as the blood is moving through your body, no, it ends up depositing that sugar into sugar not sticky to red blood cells, no, it will end up being deposited all through your body as that blood is running through your veins. It will deposit that sugar onto the nerves, going to those little nerves going to your eyes, and blood vessels going to your eyes, those little nerves and blood vessels going to your kidneys, those little nerves and blood vessels going to your legs. Over time, so one control how much carbohydrates would sugar no will blood never moving it through your system, and then over time all those blood vessels and nerves will become coated with sugar. When they become coated with sugar, this is where damage starts. And so imagine say with little blood vessels not say sugar coat over time it becomes damaged, and this is how diabetes can lead to blindness. And what Dr. Bekacha was say, once a year, kona check because say damage no ashasia at least who say okay damage na ashasia and they say at least you back say hey ebia fufu no teso kakra we say damage no ashasia and I say a draw ofa no yen a little bit more. So na etimia boa na body na use sugar will be better. The same is the reason why a lot of people may end up with amputation to their toes, to their foot, to their leg. The reason is because our blood vessels, when it becomes coated with sugar, it becomes damaged. And so let's say what now, baby, not wakotia baby so. Normally, side nerves na ekɔ wɔ nan no bɛka kyerɛ wo brain and say, hey, what here baby so share one night. But over time, so it becomes damaged that wunya sa message, into wunni. So one check your feet, debia and share and making sure say wunni cuts nessa near man wall naya. Won't so what cut to who swat. Emoja na if free will nine bano, it will sugar. And na bacteria and so epic sugar. And sa site na a channel. The likelihood set ubenya infection no high because bacteria no per se alcohol because the situation and so one check yeah fa ube no na too late what be call doctor no now you're infected na the reason our doctor need to me no if we say sa blood vessels no I say acid tunnel I say chains that your the IV drug no antibiotic can normally be used to kill bacteria no or more de IV blood vessels nanka e wo nanya e betimi dia drona call baby at what channel say I say there's no way you betimi dia drona alcohol and just say doctor any choice say was amputated or nine and I said with toe and I said BBC. Another thing that happens with diabetes is all those arteries are echo wakoma and I said heart those arteries are emoja echo wakoma no and nutrients then all that when it becomes coated with sugar then that increases your risk of heart disease. And as soon as we have diabetes or as soon as Dr. Becca said diabetes no that means that the risk of having heart disease is also high. And so this is how diabetes happens, and this is how it causes complications over time. Now, the thing with type 2 diabetes is that you have complete control. And by that, I mean that the first enemy is the food that you eat.
And see, they say your problem that with type 2 diabetes problem, they say a would, carbohydrates will. And unfortunately, your body is not able to process the carbohydrates very well. And he said, some carbohydrates, so we reduce it, and I said, we jaya. Then just said, body needs our problem, no. And sugar be a bunny more intimate process here. The sugar that's going to stay in your blood and be moved around by your blood and cause damage. All that is cut out. Another way to control diabetes is through exercise. And so we exercise and not recommendation is said just a debia so we exercise for just 30 minutes. Say what joint problems bicycle exercise. And also doctor say okay. Exercise being a if it's a we exercise what happens is that our muscles we exercise our muscles and say, hey, you hear energy, they be exercise. Into sugar beer and what muscles no be per se suck those sugars out of your blood so that it can use it to exercise. Now exercise, it doesn't have to be running, just anything. So we'll pat bonyum for 30 minutes nasa ufi. Just any way to get the body moving will help to suck up that sugar so that it's not sitting in your blood and moving around and causing damage. Another thing, of course, is by taking your medications. Medications, help our body, to better take up that sugar instead of the sugar sitting in your blood. There's different ways that medications, internet to be our doctor, 3-4 medications because yet different things our body, to use the sugar better. And so that is basically the gist of it all. What I want to also explain is the A1C. And to what diabetes now for doctor, oftentimes your doctor no can't you will A1C actually. Well, A1C, basically what it is it can't the percent of your blood that has sugar sticking to it. And see, every 3 months, you new blood. And blood at what say net January 1st, 3 months from now, you're gonna get new blood. And the A1C tells you, say, over 3 months, how much of that blood that you had sugar sticking to it. And so if your A1C is a 10, that means 10% of your blood had sugar sticking to it over that 3 months. Now, I just want to put it into perspective. Obia only diabetes, the percent of their blood that usually has sugar sticking to it is anywhere between a 5 and a 5.5. Obia and diabetes, and yet well controlled, the percent of sugar that's sticking in your blood or their A1C is anywhere between above an 8 to like a 10 or higher. Now, so what should I say? Who said, on your cry and diabetes, yet controlled, say a 10, for example, is 2 times the amount of a person who doesn't have diabetes. If your diabetes is well managed, your A1C is usually between about a 6.5 to a 7.5 or 8 or less. And so, say ABA last month, December, we'll call it almost say A1C in your cry, ABA 15. Why will be taking steps by decreasing the amount of carbohydrates, increasing the amount of vegetables. Well, yeah, why would be who said, A1C need less if you said with the less sugar. And so, and only the basic summary of diabetes and how it damages your body and ways that you can help to control it.
Okay, so me yebeti producer also Albert the person show. Producer you trail na answer what was. So Omaya obi o person obisa am say Dr. Where we are my information about diabetes and the management. And if you are there and you want to ask any question, please call 240-280-2633. or you can text us or call the WhatsApp at 510-931-0946. And right now, I think the producer is not ready. So if there's any other information, doctor, you can continue with that.
That is the basic gist.
Okay, then let me
Mhm.
start asking you questions on the idea that you have given us today. There's one or two things that you touched that I really need you to explain it further. When I go to hospital and visit my PCP, and then he tells me, oh, as I say, I got pricking finger. Now, I got pricking the finger. I'm not taking my jacket too heavy. You show me that so we should blood sugar level a beer, say, 20 point something. Some jacket one on me, yeah, with my idea, so the sikafa, you need to sugar level.
Okay, yes. And most people who drew the age of 45 or older, when you go to the doctor, and I said, so weight, a little high when you become overweight. Usually, at least once a year, your doctor will check how your blood sugar is doing. And when we start pricking up, okay, so pricking up. Different kinds. So there's the fasting blood glucose. And on it, or prick before you've had anything to eat. And you wouldn't need BBA or how much of your blood has sugar in it. The immediate amount of your blood that has sugar in it. So one prick your finger now. Before you eat now, blood sugar anywhere between about 70 to 80 to about 100 and 110, like 80 to 110 is about the average that they want to see. When they prick your finger before you've eaten and it's like 125, that is called prediabetes. So that means that you're not diabetic yet. However, you're above the range of 80 to 110. And so this is where they need to watch you. This is where they'll have to talk with you and say, hey, I said, well, body and process it sugar very well anymore. And your exercise, reduce the amount of carbohydrates that you eat because the emphasis will be due stage out where you're full out a diabetic. Well, more prick with blood, not a fasted glucose, yet above 125, not interested. What do stage out where you're diabetic? And see, do how on best your A1C, and so I check it with A1C just over 3 months, and so how much % of your blood also has sugar into it. Into a sana and also in a 6, like anywhere between a 5.7 to a 6.4 or higher, then they say, hey, we believe you have diabetes. And depending on how high the A1C is or how high the blood sugar is. And so some people might say, well, minpesa will be out testing my blood because minpesa may fight insulin. Well, they're not immediately going to give you insulin. It depends on what the blood sugar is. And so when we prick your finger and now with blood sugar yet, well, fasting blood sugar yet above 200, like 250, that's extremely high because what it should be is 80 to 110 before you eat. So if it's 250, then they need to act immediately because you are full-blown diabetic and you have a lot of sugar in your blood, and they need to help you immediately. So this is where they would probably say, hey, we need to start insulin.
Okay, trust me, sure.
Another test they can do is the random blood glucose. And to random blood glucose too. And random blood glucose means we'll call a doctor's office. No, maybe I know what did. And to I know who said, well, blood glucose no yet 300 or above, and also means that you're full blown diabetic and you probably need to start out with insulin to get your diabetes under control. If it's less than that, your random blood glucose, they want it to be less than 200. So if it's less than 200, you probably don't have to start out with that. when you have
Go ahead and explain. I'm coming. Just explain. I'm coming.
okay. Before you've eaten, like I said, your blood sugar should be anywhere between 80 to 110. 2 hours after you have eaten, your blood sugar should be anywhere between 140 to 180. So when it is above that, that means that your diabetes is not well controlled. And you can make quick adjustments, like I said, to help to bring that blood sugar down. You need to communicate with your doctor and let them know, hey, you know, my blood sugar after I eat is still 210. Or when I wake up in the morning, my blood sugar is 150, 200. This is where they start to make adjustments to your medications. And if you follow the medications and you also implement changing lifestyle habits like eating less carbohydrates, incorporating exercise, then you will see that your A1C will continue to come down. So that's basically the gist of it.
Okay, the next question is, you know, we are Ghanaians, and most often we don't do frequent physicals back at home. So, and maybe I'm a farmer or I work in the office or somewhere else. How would I know, sir? And this thing that is happening to me, I might be a diabetic patient.
Okay. Well, some of the symptoms that you may experience from having diabetes is you may start urinating very frequently. And urinating frequently could be a number of different things. It doesn't mean you have diabetes. For instance, a lot of men that as you get older, your prostate starts to enlarge and you're not able to empty your bladder efficiently when you go to pee, so you may urinate frequently. So that doesn't necessarily mean you have diabetes, but that is a symptom of having diabetes. The reason is just your God made our bodies so perfect, and when your body senses that there's so much sugar in your blood, your body wants to get rid of it, so it causes you to urinate frequently. So that's what that is. Another symptom is that you may be thirsty a lot. You know, you're just always thirsty. That's also because your body is so concentrated with sugar that it wants water to kind of dilute all that sugar in your blood. So it's causing you to drink a lot, and then you're peeing a lot, trying to get rid of that sugar. So it's a natural way for your body to compensate for that sugar. Other things, I mean, and these things could be for anything. You may just feel more tired. Some people may start to lose weight without really trying. Those are all signs of having diabetes, but it could be other things. So if you start to feel any of these things that I said, just go to your doctor and get it checked out and just see.
Okay, somebody is in the air. Somebody just sent a message to us. So let me read it to you. Can you please differentiate between type 1 and type 2 diabetes?
Yes, definitely. Okay, so
thank you, Dr. Boston.
Okay. Type 1 diabetes affects only about a very small percent, I believe like 5% or less of the population. So what happens with type 1 diabetes is an autoimmune, meaning that your body attacks itself. And, meaning that your body attacks. I think there's like some noise coming through, but it just means that your body attacks itself. So your pancreas is what makes insulin. So when you have type 1 diabetes, what happens is that your body starts to attack your pancreas, which makes insulin. And like I said, insulin is what helps your cells to use sugar. So when your body attacks the pancreas and continues to attack it, over time, it will kill your pancreas. So you don't have the capability of making your own insulin. And then with type 1, you need insulin in order to survive. And you might know actors like Haley Berry, they have type 1 diabetes. Type 2 is what I explained a little bit earlier today, is usually a result of obesity. Being overweight.
Hold on, or yes, hold on. Somebody, do you want to talk, please? Hello, do you have any question for us? Okay, go ahead. The person will call again.
Okay. So type 2 is usually a result of being overweight. When you become overweight, there's different theories. Some of them say that when you become overweight, it's almost like your cells become blind to the insulin that you make. They can't see it very well, so they're not able to use that insulin very well to allow you to take up that sugar that you ate. And so type 2 is basically a result of being overweight, not eating the right foods that will reduce the amount of sugar in your blood. So type 1 is autoimmune.
Hello.
Type 2 is usually a result of obesity.
Yeah, Bajo, Kasa. Bajo, yetio, wow, kahalo, yetio, bobodi, na kababia, kusa free, na question for why.
Hello.
Hello, Mitio.
Hello.
Hello, we hear you.
Yeah, me pacho me person visa doctor question kakro. Me question and person me visa doctor ne say. What run test na o doctor ka show so oh this time no sugar no na 105 in the before breakfast. Inti watch out. Now what checking fear is below 100, but I say and I'm already can check in the lab no more concern. Now, my question is, at the end of the day, and I don't know, does it have influence on so your lab test the following day and
Okay. That's a very good question.
that's it.
Yeah, thank you. Yeah, so would you do very, very heavy your body was not able to get rid of it, but normally in about 8 hours or 4 to 8 hours, your body is able to digest the food that you ate. So it should not affect your fasting blood glucose, but it can because it depends on when you ate. So let's say you ate at 11 o'clock at night, that could affect your blood sugar. But so would the normal 6 to 7 o'clock in the evening, yeah, it should not affect your blood sugar in the morning. And now blood sugar now what kind? And so 100 when you woke up is fine. That's well within the range. That should not be concerning. When you get above 120, 130s, 200s, before you've eaten, that's concerning. But yeah, 100 is completely fine. I don't think that should have sounded the alarm for anybody.
Okay, that's it. I hope so. My menati say. I think that you should question in fact medication or not. We are not doing justice to ourselves. Being a pharmacist, I know say more lobia modema woman say glucophage and then you let me ask you this question: what actually does the group metformin glipizide mode? What do they do to us?
Yeah, that's a great question, and it's a great question because, excuse me, it's important to understand how your medications work and why you're taking it. Okay, so metformin, like I said, when you have type 2 diabetes, one of the problems is that your body may produce enough insulin, but your cells may not recognize it. Your cells need to recognize the insulin because insulin acts as a key to open up those cells. And when those cells open up, the fluid that you ate goes into those cells instead of the sugar sitting in your blood. What metformin does is it allows your cells to better see the insulin that your body makes. So I'll repeat that again. What metformin does is it allows your cells to better see the insulin that you made. So it's kind of like putting some glasses on your cells to allow them to better see the insulin that you make. That way it can recognize the insulin, and then the insulin can open up those cells and take in that sugar that you ate. So usually when someone is diagnosed with diabetes, unless your blood sugar is extremely high, meaning that your random blood sugar is above 300 and your A1C is above 10 or so, unless it's that high, they usually will start you out with metformin. The reason is because it's been around for a long time, it's been studied. It doesn't cause you to gain weight. It helps to preserve your pancreas. And so, pancreas no, and it produces insulin. When you lose your pancreas, you have to take insulin. And so what it does is it helps to preserve your pancreas by allowing your cells to recognize that insulin that your pancreas is making. It doesn't put pressure on your pancreas to make more insulin, which is what a lot of other diabetes medications do. And so it will cause your pancreas to last longer, so your chances of having to take insulin is less. Also, it has it's been shown to also improve your risk of cardiovascular disease. So it decreases your risk of getting cardiovascular disease. So these are all the reasons why. Now, one thing that they look at before they put you on metformin is your kidney function. If you have very bad kidney function, they're not going to put you on metformin because it will increase your risk of a side effect called lactic acidosis. And that's basically like horrible muscle cramp. I don't know if you remember maybe when you were younger and you exercise really hard and you got this awful cramp in your leg. That's what lactic acidosis is. So metformin is not to be used in people that don't have very good kidney function. And so that's basically how metformin works. Another side effect of metformin, if you start it, is that it can cause your stomach to hurt. It can cause discomfort in your stomach. One way to avoid that is by eating before you take it. It will help you to better tolerate it. There's different kinds of metformin. So one immediate release and one extended release. And who said what the immediate release? Not the be alpha or tell your doctor, and they can try the extended release. The extended release means that it doesn't all release into your body at once. It's extended. It releases over an extended period of time. And so your body kind of gets it slowly so that it doesn't affect you as much. And again, taking food with it will definitely help you. But that's the basic main common side effect of metformin is the stomach discomfort.
Okay, now can you talk a little bit about glipizide too?
Yes, I'll talk about glipizide. So glipizide, glimepiride, glyburide, they all are a group of drugs in they're drugs. They're all sisters, and they're in this class called sulfonylureas. And so how that drug works is it puts pressure on your pancreas to make more insulin. And so basically, like I said, with type 2 diabetes, what happens for some people is that your pancreas doesn't make enough insulin, right? So when you eat fufu, your pancreas, there might be a million cells that say, hey, I'll take that fufu and use it as energy to help you, clean up after. But there aren't enough insulin. There aren't enough keys to open up those cells to take up that sugar. So what glipizide does is it forces your pancreas to make more insulin so that your body can better use the sugar that you just ate. And it's a good drug, especially glipizide, because even if your kidney function is not that great, it still works well. It doesn't need your kidney function to be great to use it. The only main side effect, and it's usually once a day or twice a day, the main side effect with it is it can cause your blood sugar to drop below the norm. And so you definitely want to have a little bit something to eat before you take the glipizide. And so that's the main side effect, to just know if your sugar drops, you know what to do. Drink. I would always recommend drinking something, because when you drink, it goes straight into your bloodstream. So just drink a cup of orange juice, and you'll know your blood sugar is low, because your fingers will get jittery, your heart will start to race, you may start to sweat. And you can check it. You can prick your finger and also check it. But yeah, just drink some orange juice, and that will help to bring your blood sugar back to normal.
Yeah,
It's not a common it's not a frequent side effect, but it is a common side effect. So it's something to know while you're taking the medication.
Somebody's asking this question.
Mhm.
So, why do doctors, or why do you pharmacists most of the time give glucophage and glipizide together? Why?
Oh, yeah. So glucophage and glipizide both act differently, like I just said. And so usually it's because you need a little bit more to help with managing your blood sugar. So initially your doctor will start you out with metformin, right? And then if your A1C is still above the normal, your A1C is still, 9 or 10, or above a 7.5, then they're gonna want to add something else like glipizide. The reason why they add those two is, one, those drugs are not too expensive. Two, they can help to significantly bring down your A1C. So both of them are able to bring down your A1C by as much as almost 2%. So let's say your A1C is a 10. Those medications have the capability to bring it down to a 7, if it's effective. So that's why I usually start out with those.
Yeah, the next question that I'm getting here is that, what is the best time to take these medications in order to control your diabetes?
Yeah, I would always recommend, if you're taking it, it depends on the medication. But for most diabetes medications, taking them in the morning is the best bet. The reason is, some people may take it at night. And if you take it at night and you realize that you are starting to have like nightmares, you're having a lot of nightmares, that's a big side effect. That's something showing you that your blood sugar is dropping lower than the normal when you're sleeping. Right. So when you're awake and you take it in the morning, if your blood sugar is low, you'll know, it will feel like how it feels, let's say, when you're hungry. When you're really hungry, like you start to shake a little bit, you start to sweat, okay, my blood sugar is low, I'm going to drink some water. But if you're deep asleep and your blood sugar drops, you won't know. So you may have nightmares and you won't know. Some people, if it goes really low, you could get into a coma. So unless your work schedule, you might work at night and maybe that's just the best time to take it, then that's fine. At least you're up. But I would take it in the morning. There are other newer medications like Jardiance, for instance, that also cause you to urinate out any sugar that's in your blood. And so that's going to also cause you to pee frequently. And that one you don't want to take at night, because you're going to keep getting up to pee and you're going to wonder why you're peeing so much. It's because that's the way that drug works. It causes your body to pee out any sugar that's in your blood. So for most diabetes medications, I would just take those in the morning. But take it at the schedule that's best for you, because the most important thing is that you take your medication.
So, me is that the same way that metformin and glipizide work? Is it the same way that the insulins like Lantus and Novolog and all kinds of glucose, do they do the same function?
No, they don't. So like I said, metformin allows your cells to better recognize the insulin that your body makes, so that it can use so your cells recognize, so insulin acts as a key, right? And it opens up your cells and allow them to take any sugar that you eat into your body, right? One of the big things about type 2 diabetes is insulin resistance, right? You hear insulin resistance, insulin resistance. Insulin resistance just means that your body is making insulin just fine. Your cells don't recognize it. And so what metformin does is it helps your cells to better recognize the insulin, and so that the insulin can open up these cells and allow them to take in that sugar and use it as energy. So that's what metformin does. Glipizide, what it does is it helps, it forces your pancreas to make more insulin, because the problem for some people is that they're not making enough insulin. So their cells aren't able to use up that sugar in their blood very well. And so what glipizide does is it forces your body to make more insulin so that you can use up that sugar that you eat. Now, Lantus is considered a long-acting insulin. So this is where you've gotten to the point where your body is just not making enough insulin. There's no help. There's not a whole lot of help that can be given to your pancreas to make enough insulin. So then they have made insulin for you to take, so that your cells can use up any sugar that you eat. Lantus is considered a long-acting insulin. So what that means is it acts all day and all night to help to keep your sugar levels steady. Now, you need to understand the difference between Lantus and, let's say, Novolog. Novolog is considered a rapid-acting insulin. And so what that does is, as soon as you eat, so let's say it's breakfast time and you had some bullfruit and tea, right? What Novolog does is it will bring down your sugar right away, because those things are going to raise your sugar, so it will bring it down right away. So they're basically giving you insulin because your body is not making an adequate amount. That's what Lantus is, an insulin. Novolog is an insulin, is to replace the one that your body is not making adequately.
Okay, thank you for Ms. Dr. Bawuya. Let me do my advert now before I continue my questions.
Sure.
The picture, you can diabetes one. Diabetes Arabia. So Dr. Bawuya can was some a cell nerves and the croba beton imuda a cell ni intino Arabia who here say ubia tiasie na obamoban ifrimu or more near the bomoban intino. I know na Dr. Bawuya me actually, and it is a question being now person ubusanya Mr. Fred 240-280-2633 and now say so poor baby a person WhatsApp here now the question be by now answer. Frame 510-931-0946. You ready? Was say what's in the Biano, you are. And you trust one, maybe a question about what I'm the fire in Ireland. No, can be said, no, I am no, be a boama. A beer cells, no, ama sugar in your quantum. Now, Ananka, your number drona, can sugar no way moon, no, any man call one time. Now, I feel you know the beer number drone.
Oh, okay. Yeah, that's a really good question. Unfortunately, Adrobia lasted for just a few hours. Intina, and Nobi Waha, it me lasted in our system for a week. Inti, yeah, na manufacturer na can say, okay, wait there, it's me a drummer for a week. Inti, it was for just once a week. And Robi Waha, it's me last year in our system for just 12 hours. And no one the way a drug company no make it. And Southside no almost say, okay, doctor and say fun twice a day. If you say after 12 hours, no, and yeah, dream you until it was all fun, it was all fun 12 hours. It was all fun on you, right? And sana and Robia, yeah, Jumania just diabetes medications. It's all for Drobia or yeah, once a day. If we say in your body, no, is made to just work for 24 hours and that's it. And then after 24 hours, no, your body has cleared it out. It could peak a year, your body not clear, nefe, what's off of you. And in the future, you've been in ra for one time, not and one, no, but currently in India, but your mental won't come.
My mum say a question we say.
Yes.
Madam Fubina, Obusan question, I'm say, Obi a winner no with TNT, Beboan. Ono order, my form in a grape side, and or lantos. Na, ni sugar na anopabia no a normal. And you know, I am a cost look at her. And na didi no, it's as and would didn't print the beer. Now, with these snacks being in the account. Saa nipa wei wotu no fo a anka foto be ne A1C ɛyɛ 9.5 for baabi to me bia na kɔten nti saa nipa wei sugar level yɛ fam no anɔpa bia no ɛwɔ fam ɛnyɛ yi A1C so wɔ so nti no kwan bɛ so na wogidi sɛ wontumi regularize ne blood sugar.
Okay. Somebody like that, it will say who exactly they would, because obedi twice a day, but would so would obedi no obedi, I don't know, cocoa na area would a more dear ma, with different things, and just would eat too much carbohydrates at night in the afternoon what would do nighttime no check, maybe our blood sugar is still a little bit high. And to somebody like that, men country will be I say be any fufubium and I say any mobium. Yeah, my kind of says wouldn't you A1C goal now, Pat, which at least you should try to get it below an 8. If you have not gotten there, decrease it carbohydrates, and to say be a 1 bowl of rice cut the bowl of rice into half and let half of it be vegetables. And by vegetables, there are certain vegetables that are also high in sugar, like peas and carrots are high in sugar. So they may kind of say squash, broccoli, cauliflower. So we'll pay control say hey, okay, just decrease the amount of oil. But you can eat stuff like that. We'll pay nkrumah. Nkrumah say it's good for you. Ubetimi things like that. So obedi nkrumah. Sa yode beka hono. Benku or something like that. Make it very, very small. Nema nkrumah nenye bebre. Nema nebia wama fish with the fish akahono. Those things are good for you. And the making say bia wadam for no. Ebia for breakfast and lunch, the carbohydrates high. And even though they're eating twice, when they get to evening the blood sugar is high. But the reason why the blood sugar is probably low in the morning is because they take the Lantus at night. And the Lantus helps to steadily keep the blood sugar low until for at least 12 to 24 hours into an not ABI, the blood sugar is like 80, so there's like, why is my A1C high? We'll decrease the vegetables now. Not will incorporate a little bit of exercise. Who said A1C? Or decrease the carbohydrates. I'm sorry, or decrease the carbohydrates, no increase the vegetables now. But who said? High. Also snacks, no. It was all shiny. It's already nipa beka say, okay, to say there, it's a new year, maybe be healthy, maybe fruits, maybe, fruits, high in sugar. A lot of fruits are high in sugar. And so at this point, your body doesn't recognize the difference between sugar from a cake or sugar from grapes. And so when you decide to increase the amount of fruits, your blood sugar is going to go up. And so especially dried fruits, they're just concentrated natural sugars, And so what I would do is if the snacks are fruits, I would definitely significantly reduce the fruits and replace them with, vegetables like celery or other things that are not high in carbohydrates. Beans are great. Beans are great because they help to get you full without really increasing your blood sugar. And also they help to clear out toxins in your intestines because they're a good source of fiber. So, I would incorporate all of these things into your diet because it could be say, well, maybe vegetables, no, it doesn't fill me up. Yeah, so try and add beans to it. And you'll see that it will really help to fill you up and help to control your blood sugar as well. Oh, you're on mute. I can't hear you. I can't hear you at all.
Thank you
Okay.
very much.
Sure.
I know that my friend is really listening to us. So our time is almost there. So can you please give us a summary? If no question comes, maybe then we'll put the whole thing to an end.
Okay. The summary of it all is that diabetes is a disease that affects a lot of people. Sometimes the complications that can result is because some people are in denial that they even have diabetes. And being in denial is not going to cause the complications to become less. If your doctor says that you have diabetes, you can control that. It's not out of your control. You can increase the amount of vegetables. And in our diet, in the Ghanaian diet, there are a lot of good vegetable options, you know. So open contemporary stew, for instance, do the contemporary stew with vegetables like cauliflower rice or vegetables instead of a big bowl of rice. Open kuruma, that's great, you know. It's just that the older become kuruma no hono, benku or whatever, no. Maninye very, very, very tiny. Naman kuruma and efficient and yeme bread. Exercise, and by that I mean do what you can, you know. If you can just cut out 30 minutes of your day to just dance, to take a walk around the neighborhood, if you have a bicycle, to sit on it for just 30 minutes, it will significantly help you relieve stress. Some people eat a lot when they're stressed. I tend to eat when I'm stressed. Bringing down your stress levels is very important for your overall health. I don't think that we talk about that enough, and that's probably for a whole nother segment. But look at your life and the amount of stress that you're under, and try to figure out ways to manage your stress. You know, prayer, meditation, journaling, because when you are less stressed, you're able to make better decisions overall and good decisions for your body. Stress can also increase cortisol levels, which is steroid in your body, which can cause your blood sugar to go up. And so all that is important. So I would just say, if you have a diagnosis with diabetes, feel empowered that you can take control of it. You can bring it down. You know, don't be in denial about it. Take the medications your doctor gives you. And then most importantly, also implement lifestyle changes, because I've seen plenty of patients that made lifestyle changes, lost weight, ate right, and have been at the point where they didn't need any medications. It's not a life sentence. It's just a decision to redirect decisions you're making for your health so that you can become more healthy. You're on mute. I can't hear you. I can't hear you.
Okay. Dr. Berry, I think this knowledge here was imparted to us. It's not limited to United States here. It goes all over the world. And then hopefully questions may come from somewhere. We're not getting them now. The studio manager will be writing them down. So the question will come. So I hope we're going to invite you one more time for some of these questions to be answered. And with that, I want, on behalf of the studio director, I want to thank you for spending your 1 hour, full 1 hour, to tell us more about diabetes and how we can control it. We thank you very much. And once again, I say thank you for the work that's done for us.
Oh, thank you so much for having me. And thank you for all you're doing.
Because I hate Ghana, it's slow and it's killing Ghanaians. Right now that we have given this idea, those who are sharing should continue to share and share, particularly if you're old. Just listen to this and know how you can manage your diabetes. I think if you manage your diabetes, you will live longer. Other than that, you're going to live a short life in this world. Thank you, and we'll talk again.
Thank you.
Bye-bye.
Hello, beautiful people of Ghana. This is Banahine Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Bonahini Specialist Hospital, our extraordinary physicians and nurses are here to provide a high quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us